My background is actually backwards, right?
No, no,
Yes,
that's fine.
no, it's
Oh,
fine.
seriously?
Yeah.
Okay. We have formally started, Sasha. So I'm going to say hello and good afternoon to everybody. I feel like I regularly start with hello. My name is Maria Demopoulos and I'm the CEO of the Settlement Council of Australia. I am not sure if I could come up with a more creative way of doing that, but hello, everybody. Before we begin, I'd like to acknowledge that I am certainly on the lands of the Bunurong Boomerang people here in the western suburbs of Melbourne. I'd like to pay my respects to ancestors and particularly to acknowledge that around the country we are on the unceded lands of people who've cared, First Peoples who've cared for this country for tens of thousands of years. I want to take the opportunity to thank you all. Afternoon sessions can always be a challenge, but I assure you, having heard these two speak on previous occasions, you will not be disappointed. And the significance of this research, in my view, can't be underrated. We know that right now we are at a very important point in our national conversations, particularly around workforce policy and migration. We're increasingly hearing very urgent discussions about workforce shortage, productivity discussions, skills pipelines, healthcare vacancies, regional market pressures and so on. And as skilled migration enters public debate, it's often discussed in very highly economic terms. You know, migrants become nothing more than units of labour. They become nothing more than workforce supply issues, and they become solutions to shortages. And what I certainly think at SCOA we're very and acutely aware of is that migrants are often absent from discussions as people. The reality is that it's people who migrate, not skills that migrate. And we know that people with families, they're people with responsibilities, people with aspirations about their settlement journeys in this country. So this is why I'm particularly pleased that SCOA is hosting today's discussion. The research we are exploring offers a powerful intervention in current policy debates, precisely because it gets us to think differently about migrants, about migration, about workforce retention and settlement. It's research that invites us to consider whether Australia can indeed genuinely solve workforce shortages if we continue to focus solely on attracting workers without paying just as much attention to the social conditions that encourage people to stay. So for us at SCOA and our members, this conversation really does resonate very strongly with our growing work around settlement as prevention infrastructure. Settlement is far too often misunderstood as a social support service delivered after migration has occurred. Increasingly, the evidence suggests something very different. Settlement is a workforce issue. Settlement is a productivity issue. Settlement is a regional development issue. And settlement, of course, is a retention issue. So today's research provides us with some compelling evidence for exactly that proposition. So it's now my great pleasure to be able to introduce our two presenters. Let me start with Dr. Leah Williams-Uzay. You're a research fellow at the University of Sydney, a leading researcher exploring migration, healthcare, workforce mobility and systems of care. And Leah, having met you now on a number of occasions, I'm very aware of just how extensive and vast your experience is. So I'm not going to go through your entire bio, but to say that your work particularly examines the experiences of internationally qualified healthcare professionals and that important intersection between migration policy, labour markets and wellbeing. You are an incredible thought leader on these issues. I'm really looking forward to what you can tell us about human dimensions of healthcare migration and the social conditions that shape recruitment, retention and participation. Leah, thank you so much for joining us. I also now want to introduce you to Dr. Alexandra Sasha Block, I've come to know you very fondly as Sasha, so I'm hoping that I can continue to refer to you as Sasha. But you are an applied researcher, project leader with more than a decade of experiences delivering research across migration, workforce development, regional Australia and place-based policy. Your doctoral research, Sasha, explored regional migrant settlement and the role of culture and music in shaping belonging and participation. I've had a read, you shared some parts of it, and it is absolutely mind-blowing research. Can I recommend any of you around the virtual room to have a good read? Perhaps, Sasha, you might share some of that work beyond our session today, but your work has consistently highlighted the importance of community, inclusion and place in creating successful migration outcomes, and the significant contribution that you've made to our thinking around regional settlement and retention. How fortunate are we to have you both? We know how busy you are. I'm going to hand it over to you. Thank you again for your partnership with SCOA on this important research. We've both talked about what we do with this research beyond. I think I said one of the regular comments and feedback we get from our sector is terrific research, but how are you going to socialise that research? How are you going to get the findings out? What do these mean? How do you translate them into practical implications for our sector? I know that's exactly what you're going to do. Enough of me, over to you.
Thank you so much, Maria. That's such an overwhelming introduction, but I hope we can live up to it. I'm just going to share our slides, and then I will start us off, and Sasha will take over various points, so you don't have to hear just one person the whole time. So we're really delighted to be here today to talk to you about our research and what it means for migration and settlement in Australia. And I'd like to also acknowledge and pay respect to elders and communities past and present of the lands that the University of Sydney's campuses stand on. And as we research the movement of people in the settler colonial context of Australia, we think it's really important that we recognise that sovereignty was never ceded and that migration to this place has involved mass dispossession and violence, as well as ongoing discrimination and injustice. And we acknowledge that this land has always been a place of movement, trade and connection for First Nations peoples. The report we're presenting today has been prepared by Sasha on the lands of the Arakwal people of the Bundjalung Nation and by me on the lands of the Gadigal and Wangal peoples of the Eora Nation. So we particularly thank them for their ongoing stewardship and care for these lands. So just to give a bit of context about our research, I won't spend too long on this because I know it's not everyone's interest, but it's a qualitative research project which has 3 stages. So stage 2 is a PhD project looking specifically at international healthcare students. So that's still ongoing with a PhD student that I'm working with. But in terms of the stage 1 and stage 3, we've spoken to internationally qualified health professionals who've migrated to Australia or who are planning to do so. And importantly, we've also spoken to their partners, colleagues, friends, and other family members to get a really holistic view of their experiences. And then stage 3 was when we held focus groups and interviews with industry experts, so employers, unions, recruitment specialists, settlement practitioners, migration policy experts, and so on. And at the centre of our research is the idea that migrant healthcare workers are not just highly skilled professionals, although they definitely are. They're also relational human beings embedded in family and community life. They have care responsibilities far beyond their professional roles. They have dreams and aspirations for themselves and for the people that they love. And so a policy landscape that focuses only on how migrants can fill gaps in our hospital rosters will never be fit for purpose. And that's really what we want to kind of expand on and take forward in our advocacy work as well. So in some ways, it's not a new insight at all, right? The workers are also people. So I've got on the slide here, it's a very famous quote by Swiss author Max Frisch from the 1960s, referring to the Gastarbeiter or guest worker program, which brought people from Southern Europe and Turkey to Germany to essentially rebuild post-war Germany and power its recovery. Now, Australia's had a very different migration history and the political context is, of course, completely different. But this fundamental truth remains. We cannot reduce people to their role in the labour market. And so-called labour migration, or skilled migration is how we tend to kind of refer to it in contemporary Australia, is not just an economic process. And it cannot be reduced to a straightforward transaction whereby Australia says, we'll give you a job and a visa in return for which we will get our labour needs met. We need to put humans and relationships and communities right in the heart of our research and right in the heart of our migration system. And that's what we've tried to do in our research. And this is the front cover of our report, which is freshly ready, freshly uploaded to our website. We're kind of soft launching it to you today, but you can find it on our link, which I know Ned's put in the chat as well. And we look forward to talking about it more and disseminating it further as we go along. Sasha, you're going to do this one, I think.
Yes. Thanks, Leah. Yes, and thank you everyone for having us. So jumping straight into the heart of this report, we really need to have this clarity that helps us, as helps you as settlement professionals utilize this concept of people-centered approach and really provide this clarity. What do we talk about when we speak about migrants as people? And by people-centered approach that we took in this research, we mean that we center migrants' experiences and every characteristic of their migration that underpin their movements, such as gender, race, class, culture, relationship with family, relationship with their countries, relationship with their colleagues. So we really take these aspects, these multiple aspects, as the center of the approach to migration. And we think that we should speak not just about labor migration or migration, but we really need to talk about relational mobility as the one that really underpins people's movement. We're moving not just because we need job or we're looking for employment, but we also move because we have obligations, we have aspirations, we have families to take care of, and therefore we really think that relational mobility framework better describes what's happening with migrants, what's happening with migration in Australia. So looking at people rather than just skills and labor, in this research, we asked two big questions. First of all, we asked migrants who migrated to Australia what mattered for them, what mattered for in their decision making, what kind of relational aspects actually drove them to Australia or made their decision to stay in one place or move back to country, or move. And then if it mattered for them, all these relational aspects. So the second question we asked was how we can create these people-centered systems. So based on their experiences and understanding that it matters, how we can create the bigger system that works as for people, as for places. Can we go to the next slide? Yes. And why exactly now we need to talk about this, and why we really need to talk about people-centered approach rather than about jobs and skills, which are important, of course, as well. This approach really shines a light on always or often hidden aspects of mobility and migrations, like families, communities, and institutions that make these decisions and navigate this migration process. It really reflects the roles of migrants as a key stakeholders of the migration program. In our migration programs, we talk about communities or healthcare sectors or economies or Australian communities, but we speak much less about migrants as one who actually drive all these outcomes. We also believe that in our current debates about addressing chronic workforce issues, this conversation about migrants as members of families or networks becomes central to understanding, as Maria said, central to understanding how we're going to achieve the productivity, because it is inseparable. These economic outcomes are inseparable from people's movements. And the other thing is very important for policy planning and for decision making. It really again opens another dimension of understanding how siloed areas actually should work together, like settlement and workforce, like arts and migration, or regional development and infrastructure planning and migration. So it really opens this opportunity for more holistic thinking. And of course, without understanding of these various relational and human aspects, we argue that we are facing, and it's obvious in our current context, we are facing various undesirable social and economic consequences.
Thanks, Sasha. So I'm going to talk a little bit about networks of care, which is something that's really at the heart of our broader research program. So when we shift our focus from labour and migration to care and connection, what comes into focus are the many relationships that migrant healthcare workers are involved in. So in the workplace, we can think about the formal care involvements with patients and their families, and also the professional relationships with their direct colleagues and other people in that organisation. But professional connections stretch much further than the workplace. So we can also think about the communities of practice that people might be involved in. And this is something that I saw a lot in my research with healthcare workers during COVID. We saw how anaesthetists and infection control specialists were sharing expertise and knowledge across the world. And that just highlights something that happens every day in all professions. So in our research, people also talked about the cohort of people that they went to university with or people they trained with, and how central those connections were in shaping their pathways and choices and the places that they went. So people might say, oh, actually, I came to Melbourne because, someone who was in the year above me at university was there and they told me how to do it. Or actually, everyone in my cohort all applied to go to America or whatever. So there are like the professional and cohort effects, essentially, that change where people go. And then if we move to the more personal relationships, which is some of the things that we've been talking about so far, we know that a lot of healthcare workers migrate with their partner and or their children. So some of that's about how the migration system assigns kind of points for youth, so you have to be a kind of a certain age, but also for skills and experience, so you have to have worked for a certain amount of time. And that means that key period of life where you're at the right stage for migration and the right stage of skill level, you're also likely to be at the stage where you're thinking about family formation, or you may already have young children. So the migration system and people's kind of family plans really come at the same time. And other people might be single, but they might be living with a sibling or a cousin when they first arrive. And most people also have family overseas. So we need to also think about how they're caring for each other across borders, who visits whom, what are the things that structure that, who sends money to whom, how are decisions made together or separately, how do we care for people as they're aging, or perhaps, how do our parents come and help us out when we've got young children. All of those things are these networks and flows of care that can go multi-directionally around the world. And of course, we can think about the local communities, both in Australia and back home, and how important these communities are for building a life and a sense of belonging. And another aspect that came up in our research but isn't kind of captured in this diagram is the many online communities that people are part of, and that's often overlooked in research and policy as well. Okay, so just talking a little bit about what we found in our research. One of the key findings is that migration decision making is a relational process. So it's not, very rarely is it one individual person says, I'm going to do this, I have this aim, I have this goal, I'm going to move. Most of the time, those decisions are made in relation to other people. So it might be about joining family and friends already in Australia. It might be about ensuring the safety and security of their children, or more broadly, building a better life for them. Australia's approach to work-life balance actually came up quite a lot as a means by which people were able to be present for friends and family. So it wasn't necessarily something that they knew before they came here, but once they came here, they're like, this is brilliant. I can be home for dinner with my family. I can book time off to go and care for my mother. All of those things were really important in terms of staying. And then people might be sending money back home. They might have come to Australia not for their own career or education, but actually for their partner's career or education or well-being or health. All of those things came up. And then sometimes they're looking to gain skills that they will take back to serve their community back home. And this is really important for understanding decision making. It's not just employment or difference in salaries or whatever that attracts health professionals. It's a multitude of motives. And if places don't satisfy those motivations, people won't be staying either in the sector or in the place where they've landed. So moving on to this kind of navigating the visa accreditation and registration system. So Australia, as we know, has an urgent and ongoing need for healthcare workers. But when people answer our call, the migration system, including the professional registration systems, discourages and exhausts the very people it claims to need. And we can see that in this quote from this Chilean nurse. You know, she talks about the registration process as a long process and there's no mercy. So people described it as expensive, as protracted, there are uncertain timelines, really difficult to navigate. And again, if we think about how that works in terms of people's family plans as well, it's very, very complicated. And we found that frequent changes in migration and related policies make Australia a less attractive place to settle. So people talked about jobs moving on and off the list of occupations in shortage. People talked about changes to student and postgraduate visas. And there was a sense that they didn't know whether it was going to be worthwhile investing in Australia because they didn't know whether the same opportunities were going to be available at the end of the 2, 3, 4, 5, 6, 7 years it was going to take. And then a lot of healthcare workers also start out on temporary visas with restrictions on access to healthcare and education and childcare and such like. And we really think this is a fundamental contradiction, that the people who are underpinning our core services have restricted access to them. And then I've already talked a little bit, I think, about online communities. And we found that actually in response to this very complicated landscape and a lack of clear information from official sources, people were relying really heavily on informal sources of information. So in social media groups, Facebook, WhatsApp, YouTube influencers, and paying for coaches, so particularly to get them through kind of exams. And we're really worried about the potential for exploitation in these private online spaces that are really kind of sheltered from any scrutiny. Okay, and then there's been a lot of talk about the undervaluing of migrant skills as an impediment to joining the workforce in roles that match their skills. So there's a lot of campaigns going around skills recognition, and we certainly found evidence of that. But what we also found was that this continued even when they joined the workforce in a hospital or a clinic. So we found people found that their expertise and their experience was undervalued because it wasn't gained in Australia. And so it was just kind of made, it's like, that's fine, but we don't really care about that. And they also found that they themselves as professionals were undervalued or discriminated against, whether that's by colleagues or by patients. So people really found that was quite denting to their pride and their self-esteem and their professional identity. And then in terms of this sense of people as relational beings, people told us that workplaces, especially in regional and rural areas, are really underestimating the importance of healthcare workers' settlement experiences for themselves and their family. So, you know, you're not just recruiting someone to fill a gap in your roster. If they can't find a suitable place to live, or they can't find a sense of belonging in the community, if their partner or their children aren't happy, then they might not take your job in the first place. And we certainly heard about people who were really struggling to find jobs, but they were still going to turn down that job in that place that didn't have the high school, that didn't have the infrastructure that they needed for their family. And even if they do stay, they won't stay for long. And so that's about valuing and caring about the whole person beyond the workplace, thinking about recruitment practices that demonstrate care for the whole person and their family, and thinking about what potential workers will need to be able to build a sustainable life in your community. And we did find that some employers had initiated innovative recruitment approaches or have taken on some of the functions of settlement providers in the absence of designated support in order to create these long-term retention outcomes. So they were helping with housing, they were helping build community connections, they were helping with innovative leave practices so people could potentially go home and look after aging parents, for example. But we found that despite some employers' willingness to create these welcoming practices, these efforts can't fully make up for the structural gaps at local and national levels. But they are really trying their best, and we think it would be great if more employers did that. All right, Sasha, I'm going to hand over to you for the next couple of slides.
Yeah, I think it's going to be the most popular slide in this audience.
Yeah, giving you the high.
I hope. Yeah, I hope I will answer some of the questions that I saw in the chat. So and this slide we spoke about settlement and entering Australian communities generally, but regional communities, of course, came up particularly stronger as a gap, as an issue. And I think there is no need to explain in this audience that temporary skilled workers, most of them do not have designated settlement support, which means that one of the quote we had from the recruitment agent, she was commenting on the situation is as like you dumped new people in the middle of the city without a map. And this is what stuck with me quite strongly. So basically, what happens as people arriving with sometimes with their family in some areas. Let's imagine in the regional areas. Of course, we know and we well aware of the housing is an issue number one. Transport or connectivity with services for families and for themselves. It's undoubtedly an issue that we don't need to speak about because it's quite an obvious situation. But what is less obvious is that even if we have these shortages of infrastructures and we have this scarcity, the access to these scarce infrastructures is relational in many aspects. For example, you need to know particular real estate agent or particular help who could say to you, this is how you approach things. This is how I can connect you with the housing or with settlement services. So there are relational hidden aspects of accessing even brick and mortars infrastructures, but we do not provide this support, and therefore it's a responsibility of this person to work it out while at the same time they're caring, while at the same time they're working, while at the same time they're trying to work out their next visa step or just to get the head around where they landed in. So this is definitely a big barrier. And of course, apart from this immediate orientation in the place, immediate survival, there are always a plethora of long-term tasks like finding your community, finding your roots, finding the space to belong, and working on your social capital, working on your cultural belonging. So these are the aspects that's not just hidden; they are not acknowledged as equally tangible as infrastructures, as brick and mortars that we often speak about at length. But this is the barrier that actually make many places, if migrants don't find this, their community, if they don't find the helping hands, it directly relates to their decision to stay or not to stay in some particular location. And of course, as with examples of welcoming employers that we found, we also have areas and example of welcoming communities or particular services that render this support. And we have multiple examples, like in New South Wales, it's the Welcome Experience pilots and New South Wales champions in this settlement field, quite strongly. But at the same time, in other areas, in other states, we have various pockets of initiatives. Many of them are grassroots or community initiatives or pilots. So this settlement support is fragmented. It's often on this pilot 2 or 3 years basis. Sometimes it's a case then the essential the essential role of these connectors or settlement services, they are not funded, so they might fund a website or some educational materials, but they won't fund a very person who provide this help and connection. So it's really patchy, it's fragmented, and it's not in a systemic level as it should be if we speak about redirecting these skilled migrants into regional areas. I think I spoke quite at length at that. So, and what we end up with, if we do not have not just only settlement support, but all these various barriers, these implications that particularly acutely felt in regional areas, because in some of these areas we have up to 50% of workforce presented by overseas trained doctors and nurses and healthcare workers. So we have these ripple effects of impacts. When people do not, they don't feel supported and they don't know how to navigate difficult systems, and their families are not happy. Of course, it creates an impact, first of all, on themselves. So migrants born, they bear these costs themselves by, making a decision to relocate or, silently suffering and trying to get on with this situation. Then it creates an effect on the workforce. Then recruitment agents are recruiting constantly, and there is a churn of volatile workforce. And of course, the cost of recruitment goes up. So it's not exactly good for healthcare sectors or for the business. Then in turn, it creates a community effect. Then we don't get a required consistency of care or quality of care, and people have to travel long miles to get some particular specialist, and they may not be in a position to travel because it might relate to affordability of this care. So it really affects then, places in generally. Are they become livable if we can't get necessary health care? Would somebody move there if they don't have a particular healthcare services in place? And then, of course, to make this snowball bigger and bigger, it creates these inequalities in regional and metropolitan places. And we speak about inequalities that might be based on these tiny things like healthcare workers being unhappy and moving, and then it's just rolling over and create these negative national impacts that we mentioned at the very beginning of this presentation. And this is not just pertinent for regional Australia. It just came more stronger in regional places, but it applies to to various places in general. Oh, my slide again. So yes, so our report that you can see and download it on the website, or it's been attached to the chat room as well. So we really speak. Then we have so multiple barriers for people that we need so much. So we really looked at the multiple implications of this not people-centered system that migrants entering, and we created quite a detailed table and information about the multiple hidden costs that migrants bear, and they can be a very material, there are financial costs of visas and services that they have to pay for, or they could be very, not so material, but still tangible, like cost of well-being, cost of relocations, cost of not being welcomed in a particular place, and we really tracked how this multiple effects, how this multiple costs actually impact all our migration system. Why we can't talk about the productivity if we are not addressing migrants' well-being, for example. So this is what the report presents, but I just wanted to put this very wordly table on your screen, so you can make a screenshot, or we will distribute this later, just to make a resume. What kind of system, what kind of migration system we have now, and what we actually mean by people-centered migration system. And you can see that what we have now have multiple purposes, and sometimes very conflicting purposes. We have this transactional approach focusing on skills and ignoring families, cultures, and other characteristics. We have inconsistency between what we actually understand as good skills, then we're ignoring partner skills, for example. We have silent approach. So we know it, but we just decided to give it in a more systematic way. And this is the way we understand as people-centered migration system, which is place-based, preventative. This is what Maria was talking about, preventative infrastructures, holistic in governance, that understand holistic benefits of migration, not just economic, but social, cultural, and others, and that brings migrant experiences at the core of the system. So this is, in a nutshell, what people-centered migration system looks like. Over to you, Leah.
Okay, so this is just, our report has like quite a few pages of recommendations. So we thought we'd try and boil them down to, I think it's 7 now. So kind of related to the previous slide. We really think that the migration system needs a much clearer set of objectives and principles to guide it that links migration with Australia's economic and social well-being far beyond labour outcomes. And that's also about the political and public discourse, where we're often talking very kind of transactionally about the different costs and who's bearing the costs. So that's another one of our recommendations, that we rethink how we think about costs, the costs of meeting Australia's need for labour and who bears them. So at the moment, we've got, migrants are bearing huge costs in terms of exam processes, documentation, moving costs, setting up a new life. And then we're welcoming them by saying, oh, well, that's fine, but we don't think you should have access to any of the social supports that we have as a society, even though you're paying into them and providing essential services, and the costs of recruitment failures and things like that that Sasha talked about before. Very straightforward recommendation in terms of recommendation, but hard to do, is the streamlining of the professional registration and skills recognition systems, reducing the financial, logistical and informational barriers for applicants. And that's been a recommendation of a number of reports now, and I know that there is work ongoing, but just to kind of say that is a big problem. People are really, really struggling just with navigating, so we essentially say we would like people to come and and work in our healthcare system, but we're also going to put like huge numbers of barriers in your way to make it really difficult for you to do so. So streamlining those. And then again, what Maria was talking about before, we really think that we need to embed settlement support in skilled migration programs, especially in areas of workforce shortage in regional and rural areas, and to invest in programs to achieve this. So a lot of you will be working in settlement support, but often organizations are only funded mostly for humanitarian entrants and maybe for partners or people with very low levels of English. But we actually found that even though people are, skilled, intelligent, professional people, they're really struggling to find their way, particularly in regional and rural Australia. It can be very different from the areas that they've come from. And we think there needs to be significant investment in programs to support people so they can stay where they need to be. And we would like to assist employers in becoming welcoming employers to skilled migrants and their families. So that's talking about being involved in the whole settlement process, changing induction processes, thinking about leave policies, and a general culture of openness. This is something that people really found very difficult, is they just found a very kind of closed mindset that any expertise that was coming from overseas was just worth less than something that had developed in Australia. And we think that we need to support partners of primary applicants whose skills and well-being are currently overlooked. So we talked to quite a few people whose partners were healthcare workers, or they as healthcare workers were partners of a primary applicant, and they're just completely invisible in the system at the moment. And we think generally that we need investment in long-term multicultural and community programs to strengthen local cultural capabilities, cohesion and retention. It's a two-way process. We all know that. It's not just about migrants being supported to, integrate and assimilate. It's also about communities having that capability and willingness and skills in terms of welcoming people and building infrastructures and community supports. And a lot of the time, there's a lot of really goodwill of people to do that, but they just don't have the resources. People are really trying very hard to do a lot of that community work on very little funding. So we think that needs much more attention as well. And so this is a few details about us. This is our project website. This is how you can kind of get in contact with us, and that's a QR code if you want to scan it, if it's easier than getting the link. But we're happy to continue this discussion. Maria, I'm happy to bring you back into this discussion.
Yeah. No, that was fantastic. Thank you both. Look, I've already noticed that there's a series of questions. I had a couple if I could ask them, and then I am going to turn my attention to the questions that are already in the chat, and so many hands that I expect are going to come up based on the interest here. Look, the proposition, the key theme, obviously, of the research is that we're talking about people here, and not people don't come as skills, they come as people, and it just seems so obvious to me when you say it out loud. But let's kind of get back to this sort of practical application or implication. If you think about the insight that your research has really highlighted, what does that mean in policy terms from your perspective?
Yeah, so like you say, it seems really obvious. And sometimes when I was talking to people, I was explaining the project to people, I'm saying, okay, I'm talking to you because you're a healthcare worker. And really the basis of our research is that healthcare workers are human beings. And you can just see everyone going, well, yeah, I'm kind of aware that I'm a human being. But in terms of but that gets lost in a policy landscape, which is all about systems and numbers and all that kind of stuff. When you put the human and the human as conceived of as a relational being in the center, you can suddenly see how all these different systems overlap and clash and conflict as they are experienced by the people going through it. So you can see that the visa process and the skills recognition process duplicate efforts, they multiply costs, they run on timelines that don't match up. And you can see how that impacts on people's lives and choices, particularly, like I say, if you put those timelines alongside people's personal timelines, perhaps about, forming families or needing to care for aging parents, those real human timelines don't at all match up with these kind of systematic timelines that people go. And it also allows us to bring into focus people who are lost in the official statistics and policies. So I gave the example of the partners of primary visa holders, and really like that, those are really a forgotten group. And there is so much talent and skills in that group, and people are just finding it so hard to get into the labour market. And some of those, and often the way that we think about that, we often think about the primary applicant as maybe the skilled professional, and the secondary applicant maybe as a wife or a mother or something like that. But actually, so many people that we spoke to are in dual career relationships, and they both have so much to offer in terms of skills and the labour market, and they've just got these barriers. And then you can really understand how people actually make decisions about when or whether or where to move and whether they'll stay. And that means you can make policy that works. You can make policy that respects people's dignity and honours what's important to them. And it makes it much more effective. So I can just give you one example from the research. There was a woman that I spoke to about a year ago, and then I had the opportunity to speak to her again last week. So when I spoke to her the first time, she was actually living in the Middle East. She's from India originally, and she wanted to move to Australia. She's a very experienced physiotherapist with over 15 years of experience. She's got 3 teenage children and a husband. And one of the things she said to me a year ago when I spoke to her that really stood out to me is like, I really want a forever nest for my family. That's what I want. And so she's now been in Australia about 4 months. And so when I spoke to her, I said, so like when we spoke before, this is what you said. And do you think you found that? Have you found a forever nest for your family? And she said, no. She said, no, I've got a job, I've got a home, but I've just got this overall sense of just scraping by. Like I've spent so much money in getting here. It's been so tiring. I found a place to live, but it was really difficult. The kids have found schools and found friends, but my husband doesn't have a job. He's really lonely. He's kind of, lost a bit of sense of himself. Everything's so expensive. And I really thought I was going to be able to, at some point think about buying my own home, for example, and that just seems completely off the table. And in terms of careers, she's working in a job, but it's not at all what she's got huge leadership skills. She's a senior practitioner, and she's like, I'm happy in my job, it's fine, but it's not what I want to do, and it's not making the most of my talents and skills. So she's kind of hopeful but bruised, I suppose. And I would think it would be so nice if we didn't do that to people as part of this process.
Yeah. And more government is talking about relational contracting, lived experience, putting people at the centre. You know, I do wonder what would it look like if government actually did start with people rather than labour market forces or inputs. You know, it would be a very different sort of scenario. Look, before I do go into the questions, and I'm going to invite people to either use the chat function or to raise their hands, was there anything that surprised you about the research? Anything that challenged your own assumptions?
Let me probably reply to that, Maria. Then we spoke, so because we spoke quite a lot with regional settlement practitioners and regional employers and recruitment agents. It really came up, and I'm actually partially replying on the question in the chat. It really came up quite strongly. And then they arranged this work in a very collaborative, resource sharing way. They understand exactly the correlation between, we are not going to achieve our economic strategy if we are not going to make people, feeling belong to this. So I heard from Regional Development Australia practitioners, which is economic agency. They care about economies, but they were saying to us, we really are preoccupied with people's belonging and connecting the various communities and doing things that they are not supposed to do because they understand this correlation. And I think that in regional places, they understand these people-centered systems very well in this practical level. Where then it comes to upper systems, so we understand that the state government and federal government can support these initiatives. They sometimes fund this initiative, but it's not the way the machinery works. And this is the governance contrast, or if you say conflict, because places work in a people-centered way. The higher you go, the less you see that.
Yeah, no, it's very good. And it does seem like you might have answered some of the questions. And Carmen, if you want to elaborate, of course, feel free. But as Carmen says, your research highlighted the importance of settlement and belonging for the maintenance of healthcare workers. But what specific strategies, and I guess people are looking for that practical strategy that you thought was one of the most effective in helping migrant healthcare professionals and their families stay? I know you've touched on this, but was there a standout strategy where you could say, if this really was about maintaining and retaining, anything that really stood out?
I think for me, I'm interested to hear what you think as well, Sasha, but I think that really what stood out to me was the people that we spoke to who are in these kind of community connector roles or these navigator roles. They're often funded through this kind of Welcoming Australia type kind of pilot project, but this real kind of almost hand-holding sounds a bit kind of parental, but like really like starting from scratch, like before people even arrive, making contact with them, finding out what they need, like going to open houses and showing, because so people could get an idea of what the housing was like before they even started, connecting them with schools, connecting them with childcare, connecting them with community organizations. There's some really, really good pockets of amazing practice going on. And I think if you can start people feeling confident and a sense of belonging, and those people, those community navigators, they are in the community as well. So they might be going and they're going to pick them up from the airport, or they'll send their colleague to pick them up from the airport. And there's, it's almost like belonging is created from even before day one. And I think when you get that experience, like none of the healthcare workers that we spoke to had that experience, right? They all, but those were people that I spoke to, and they were talking about how they did it and what they were doing, and they were finding it very very successful. The thing they worry about is the fact that their funding's running out in a few months, or they're going to lose colleagues because they need to move on to other projects. So this fragmenting of that. But in terms of that real people-centered like approach, that finding out what they need and being there at the end of the phone, being there in person to actually provide that. And I think that might not really be so possible in big cities and things like that, but in small communities, I think it really, just having a friendly face, someone you can call if there's something that goes wrong and you need help. I think that was what stood out for me as amazing practice. I don't know what you think, Sasha.
Oh, yes, similarly, I just wanted to highlight that what you just described, Leah, is a primary function of settlement services who work with humanitarian migrants. We just don't have, it's like we have this interesting silo, which is amazing to me, because if you just start doing the same thing with skilled migrants, you will get the same amazing result. Yes, the other just thing to highlight that the good practice was then the recruitment agents and employers, they were working with settlement providers together, because they realized that one thing doesn't work without another.
Yeah. Is that different, though, to your concept of networks of care? Because, again, some of the questions relate to, and you've really pointed this out, community connectedness, any programs around community connection. But it seems to me that the concept of this network you've talked about is actually quite deliberate and specific. What sort of investment, though, are you talking about when you talk about this idea of network of care?
Yeah, that's really important, and that is what question that we ask people is, where are you finding your social connection? Where are you finding your people? And people have a range of answers to that. So some people are very well connected. They're like, oh, I'm in this massive WhatsApp group of all Brazilian physiotherapists, and we all get on. Or sometimes people find their community at work or in their church or whatever. And it's very bespoke in that sense. So, everyone has their own way of finding it, but it's just, I suppose, for us, it's really about acknowledging that that's important, that building a life includes building connections. And if people find, people were saying that they wanted to go to Perth or to Melbourne because that's where their cousin is or where their brother is. So if you want people to go to places where they don't already have family, you have to be able to set up these kind of networks and communities so that people have people. We all know what it's like to go home at the end of the day and have no one to talk to, right? Like, it's really important. And that can happen through sports, it can happen through cultural activities, it can happen through religious organizations. And it doesn't mean that people have to just be within their own kind of group and stuff, but really being open and having that kind of open mindset.
Yeah. We've got a question here. Thanks, Rawanthi. And again, if you want to elaborate on any of this, feel free. But have you been able to quantify the economic cost of not having a solid social support system? So where we kind of looked at the benefits of having it, but what about the reverse? Can we estimate what the cost of not having it would be?
I'm sure someone could quantify that. I don't think that we are the people who can quantify that, because we're much more. So in terms of our expertise, it's really about listening to people's stories and understanding the qualitative experience, so what it's actually like for people on the ground. But yeah, that's certainly when we've thought about how we can extend this research into that kind of health economics area. That's something. I mean, it's always hard to put a specific dollar figure on something, and in some ways it's something that I'm quite resistant to, because I don't really like reducing people's experiences to figures on a budget sheet, but I know that that's often the language that works. Sasha, I know you had a lot of thoughts about costs and stuff, so I'm going to stop talking and let you speak.
I love this question. Thank you. Yes, it's a great question, because at the end it's like, all right, so what? What's the cost of us putting settlement services in regional areas, and what's the cost of us not putting settlement services in the area? So it's really, I think it's a really great food for thoughts on the next stage of this research, Maria. And yes,
we're keen to progress it.
Yes, exactly. So but I think the logic, what we done, so we haven't put the dollar figures, it's our it's our report, but what we have done, we highlighted, we documented multiple costs that that we heard from various stakeholders, and these costs included as monetary costs. So we did have like, what is the cost of visa? What's the cost of relocation? What's the cost of the exam? So it's desktop research available costs. But we also talked about well-being costs. We also talked about social costs for the communities. We talked about broader social costs for the society. So I really think that apart from doing this necessary step of documenting the economic cost of not having, we really, in the logic of our report, in the logic of this people-centered approach, we really need to put this framework, more holistic framework, well-being, economic, social, and cultural costs, and then work across these indicators. Because otherwise, if we start with economic cost, we are not going to achieve, we stuck in the logic of the transactional system then. We really need to go further than that. But thank you for, I really think this is what we should be doing in the next phase.
Absolutely. No, it's a very, very important question. For policymakers that might be sitting here in the virtual room and they're listening to the conversation right now, I know you had a number of recommendations there, but what would create, if there was one recommendation that would create the greatest impact? I mean, government's often saying this, okay, thanks for your 50 recommendations, but right now, fiscal constraints, our realities in terms of what we can and can't implement. But if I was going to have the greatest impact with one of those recommendations, what would you say it was?
Okay, well, I'll go first, I think. And I'm actually going to do two, I actually think that removing the barriers to essential services to temporary skilled workers would have a massive impact. So that's things like having access to Medicare, having access to childcare subsidies, having access to paid parental leave, and all those things. So going back to what I talked about, in fact, the timelines about people's family formation and stuff, we're talking about people who are absolutely dedicated to their careers, and they also want to be parents, and they also want to access the healthcare that they're providing. And I think that there's a real moral and ethical and practical implications for the fact that we actually deny that to a lot of our temporary workers. So I think, and that's much broader than healthcare workers, but I think that would make it, and that's one of the things that is keeping people back from being able to join the labour market. Like if you can't access childcare and you're paying for your children to go to public schools, that's really I think that's a massive thing holding people back. So for me, that would be the one thing. How about you, Sasha?
What about you?
Yes, always tricky question to come down to one recommendation. I really had quite a big and abstract recommendation, because then Leah says that we need to really unlock this Medicare and all this stuff for temporary migrants. We will get the same question of what's the cost? It's too expensive. We can't do it. So my recommendation, which is quite a big one, and this recommendation is not new again, because it was said in the migration review that we really need to come over this economic rationalism, economic determinism, and understand and embrace the social and cultural long-term costs and benefits of migration. Because without this logic, we can't make decisions right now. I unlock, Medicare or settlement support without, unlocking our lens to people-centered approaches. However, so I'm speaking about big decisions, but I, as a migrant, as a temporary migrant myself, I really think that the practical thing is just to expedite the decision making and around visa backlogs, because it hasn't shifted for several years. Expedite the decision making about skilled migration in regional areas. All the information that we had, we provided for the decision making. We really need the decision making so we can actually move on and progress. Yes.
Is there any other questions? I can't see somebody raised their hand then, or didn't. Did I miss something? Sorry, there was one hand that went up and then came. There it is, Margaret Piper. Hello.
Oh.
I thought I missed it. No?
Hey,
and Jackie, I don't know if you're online. I can't see Jackie, but Mark, go ahead.
Just two very brief comments, if I may, Maria.
Oh,
And
yes, of course.
first to Leah, thinking about your physiotherapist and how sad it was that there wasn't an assigned buddy or support worker who could simply say, the first year you will be, scrabbling like a swan, sort of, and everything will feel strange, everything will feel hard, just as it does for any one of us starting a new job. But to just say, to take away the anxiety by saying it's normal to feel out of your depth. And I think that is such an important thing for people coming into a new country, as opposed to, her going through the, have I made the wrong decision, bringing my family here and beating herself up for that. And then secondly, very briefly, the work that you have done is so important. And the most important thing I think about is that while it is specific to healthcare, its applicability is so much broader. And this is where I hope, and you were hinting at it several times, that when it is being discussed in a policy context, it is said, here is a deep dive into a particular area. But if you were to talk about a whole range of other professional areas, it would be exactly the same. And we need to look at this holistically, not just as a response in a particular sector. Yeah. So congratulations to both of you.
Thanks, Margaret. And just I think that's true. I think, there's a lot of stuff that is very normal about migration. I mean, I've done it, Sasha's done it. I think, a lot of us here in the room will have done it. And we do recognize that there's absolutely just challenges that come with that process. And some of them will come with change. I think that what I really noticed from her story was how beaten down she'd got in the process. So the fact that she had applied to, hundreds of jobs, and like I say, she was an incredibly skilled and senior physiotherapist, and she only got, I think, 2 job offers. One was in a very rural place, so she's like, I just can't take my kids there. And this was the other one, and it didn't match her skills at all. And she's like, I'm going to keep going, I'm going to keep applying, because she was the response that she was constantly getting was that we just need Australian experience. And, I know that's a common experience across a lot of, skilled professions, but she really felt that she was already being undervalued before she even got to that point. So, so the year was about, as you say, is about settling herself, settling her family, her husband, finding work, all of those things, but also kind of rebuilding her self-esteem that's got really bruised in that process. So I think there are some things that are just normal and natural. Like you say, we could help them with a buddy, we could help them with settlement support, all that kind of stuff. But some of it's just, we don't need to bruise people as much in the process.
But just to make sure that those people are there, that is seen as being an accepted part of induction, as opposed to something that we just expect to happen serendipitously, which may or may not.
And I think that is actually an extra, just not to talk over you, Maria, but just in physiotherapists in particular are often very isolated because they're working in as single practitioners in a clinic and things like that, which is quite different from being in, a hospital environment or a bigger clinic. So physiotherapists particularly struggle a lot with isolation, that we found.
Sasha, were you going to add something?
Yes. I just thank you, Margaret, for these remarks. And I just think this remark about the bodies really highlights that people-centered approach doesn't mean that it costs a lot. It just asks somebody to help, or just give a good nudge and support, and this is what applies to policy planning and to settlement planning, because we think about this policy support as investment that is costly. We need to create a designated service office and all these things. But we do have, and it's a question in the chat, we do have ethnic communities, we do have churches that are already there, we do have libraries and school and others. So we have this wealth. In community wealth, we do not think about this as an asset in settlement. It's a part of settlement infrastructure. So we really need to look again from the people-centered perspective how this can actually work and what cost actually means. Yes, my point is that it doesn't mean that it will be costly.
Yeah. Thank you for those responses. Can I ask maybe a slightly more contentious question, in the sense that we've heard lots of negativity right now around migration, and that discourse, I suppose, that essentially says too many migrants, et cetera, et cetera. I mean, the reality is that that can act as a deterrent. I certainly see it in the consultations I conduct with our members in the regions. Did any of that come up, and was there any sort of strategy around the need perhaps to build better safeguards around some of that? Because we are also seeing examples where people have settled in the regions, but for those kinds of reasons have moved back into the urban centres, and that is a reality. Anything that came up that we could sort of learn from?
Yeah, that's interesting. So I did speak to some people who had been in regional and rural areas and had moved to urban centres, and that was sometimes about safety and security. In terms of their experiences, they tended to talk more about the impact of kind of racism or discrimination from colleagues and in terms of career progression, rather than from clients and patients and things like that, or in the community. I think people are quite wary about talking about some of those experiences as well. It obviously depends on the context, and it may be something that comes up a little bit more in your kind of consultations than in our kind of research. But certainly, in terms of, you know, people's environment just being more hostile. You know, you can see it on comments online. You can see it on, you know, even in, you know, obviously in Parliament and politicians and things. If you know, people are working in frontline services, that's, you know, and if you're making the environment more hostile for people who are working in public-facing frontline jobs, you know, that's about respect and dignity at work as well, and that does make life more difficult, certainly.
Absolutely. I can't see any other hands, and I know that Helen, who's had to leave, a few people have had to leave, asking about great, not enough time, lots of questions, some good services provided in government through DTWD, through Migration Services, yes, connected up, and we will be talking further. But I'm going to have to jump off myself. Georgie, I'm going to hand it over to you to sort of check in and see there. Oh, there you go. Rwandi's got one more question. But certainly, as far as I'm concerned, this is such critically important research. We at SCO are really hoping to amplify and take it forward and look at what we might do from that advocacy position, because there are so many important recommendations there. But thank you from me to you. I really have thoroughly learned so much from both of you, and I see the partnership moving forward as just getting better and better. Thank you.
Thank you, Maria.
Thank you, Maria.
Okay.
Thanks, Maria. Do we have time for one more question from Rwandi? Because I'm conscious we've only got a few minutes left.
Yeah, I mean, I think it was more of a comment than a question, but it's something, you know,
okay.
she's talking about the fact that, you know, she's got, you know, a friend who's really tried really hard to make it work and is working as a dental assistant. We spoke to a lot of people who are not working in the careers that they are qualified for, whether that's dental assistants, they were working as assistants in nursing in aged care homes. You know, as one of the people that we spoke to, you know, she was working as an assistant in nursing in an aged care home, and the senior nurse was just like, please get your registration, because I need you to work in this capacity, because I can see you're the most highly skilled nurse in this place, but I can't let you do the things that you're capable of doing, because, you know, you're not allowed to do that. You know, physiotherapists working as allied health assistants, you know, it's a really common story, and there's really just no need for it. Obviously, you know, in healthcare you have the extra safeguards. You want to make sure that everyone that practices in healthcare is safe to do so, and that there's no kind of risk to patients. But we're definitely putting barriers in people's in the way of people, and wasting the talent and skills of people who are already here.
And the economic impact on Australia, you know, as much as the individual impact of individuals who come here with so much to contribute. on behalf of everyone online today and of the sector and my colleagues at SCOA, Leah, Sasha, we can't thank you enough. It's been so generous of you to come on and share your research. We have put a copy of the research in chat, and I do encourage you all, find the time to read the full document. It's invaluable. As Maria said, we are going to continue to amplify it and take forward particularly those recommendations that relate to settlement. So thank you both so much on behalf of all of us online, as I said, and of the sector. We have recorded the session. I know there were some comments about can we access the recording. Yes, we will be sharing the recording as well as the slides, which Sasha and Leah have so generously said they will share. So we will send those out to everyone. And I think that's it. We can give you back another 5 minutes towards the end of your day. So thank you so much, everyone. And again, Leah and Sasha, have a great afternoon.
Georgia.
Thank you.
Thank you.
It's been a pleasure.
Take care.
Bye-bye.
Bye.